picture, someone? I know it's being live, but we want to be able to.
All right, we're live.
Hey guys, welcome. Thank you for tuning in. Give us a couple minutes. We're gonna wait till some more folks log in before we start. Maria Menendez, good to see you, Maria. Thank you for logging in. Thank you for participating today. Give us a couple more minutes before we do this, before we go live, in terms of we bring everybody up. Perla Tabares Hatman, welcome, Madam Chair. Thank you for tuning in. It's great to have you. Thank you for all the hard work that you've been doing at the school board level. I know we're waiting for Luis Collazo. He actually just jumped in. Luis, we're going to wait for you for a couple minutes. Alejandro, good to see you. Thank you for logging in. Eva, good to see you too. So we're going to go ahead, we're going to start, but we're going to wait for Councilman Collazo to start our Mental Health Thursday. We have a presentation. So when we were doing our COVID-19 test here in our community, when we were doing the antibody testing specifically at Royal Oaks Park, the company I was putting together, Rafa Aman, had donated a great gift to one of the folks giving blood. He said, hey, we're going to raffle this off. So he wanted to make an announcement today and give it to the winner. Ralph, I don't know if you want to come up real quick. Here in our Patricia Stanley, good to see you. Tony Mendez, thank you for joining us. Esther Sanchez. Ralph.
Mr. Mayor, Manny, thank you so much for having me. Miami Lakers, how you guys doing? I want to say thank you so much. Great support that we've had through blood drives throughout the city. On behalf of our CEO, Bob McKee, and Rafa Aman, Vice President, we are very grateful. We want to give back, like I said, to the community. We did an outreach program for the blood drive with antibody COVID. We had over 260 donors that donated to the Miami Lakes. We decided to raffle off MacBook Pro, and we have one of our winners today with us to present MacBook Pro. We had an enormous amount of response from Miami-Dade to Broward, from the cities of Pinecrest, from the cities of Coral Springs, Margate, and the winner, over 2,000 donors that we've had. Our lucky winner that was drawn in does live in the city of Miami Lakes. We're very grateful for what she's done, the courage of saving lives, which is the most important part. This is why we're here. We're here about driving the message that we want to save lives. We're here to help the community give back, and give back with antibody-free testing. It's something that I think as a community, as a nation, we want to continue. We're going to continue partnering up as we spoke. We're going to do another blood drive here in the city of Miami Lakes. We want to help and give back, like I mentioned. We want to beat this pandemic. The more we test, the better we're going to be off. And the most important part, that we got to be standing united as one. We hear innovative transfusion medicine is not going to stop until we win this fight. So I want to introduce our winner, Margarita Guerra. Thank you so much. She brought a little sign to see the importance of donating blood. And Mark, please speak, and whatever you want. I'll hold the sign while I give you your gift. Thank you so much. You can open it.
so much. This is the last thing that I honestly expected for that blood drive. It was actually the first time that I donate blood. And to all of the people in the community, and especially you, I just want to say it's everything you guys do for this community. That, you know, I wanted to make a difference, but I also wanted to give back to the community because everything that Miami Lakes does for us, I've been a resident for over 22 years. And there's nowhere that I would rather live than here. So to all of you, thank you. And like I said, this is great. Obviously, I'm very happy to receive, but I also want to encourage people. This is a lot of things are going on that are terrible in the world right now. By donating blood, we can make such a big difference right now. And also, for all of you Miami Lakers, I mean, the people here of Miami Lakes, you know, we're pretty tight. Everybody, the town has always given back to us, and this is a way that we can give back to them. So, again, I just want to say thank you, and if you can donate, and hopefully we'll be seeing a lot more blood drives here in our community.
Yeah, we'll be back, like I mentioned, and thank you so much. You know, I'm glad that you're happy with our staff of intermittent transfusion medicine. As you guys know, we practice all CDC and FDA guidelines. We follow all the protocols, and donor safety comes first, as you aware know. Without the safety, donors do not feel comfortable donating blood. And we have proven to you, like I mentioned, and thank you again. If you want to open it, however you want.
Let me show everybody here. This is just awesome.
Oh.
Awesome. So thank
It's the
you
least
so
that we
much.
could do for saving 3 lives.
Thank you so
Whoa.
much. Thank you.
Again, thank you for being part of the family of the ITM.
blood right now.
Right now. I figured the odds were against so many people, you know.
And it was your first time, like you said, first time. It's
I wanted
amazing.
to give back to the community.
Thank you.
So, like I said, I think every time I see you, I'm out sandbagging.
Yeah.
No, it's again, Margaret, thank you so much. But the most important, thank you so much for the city backing us up, for the mayor. I mean, the outreach every time that you mention blood drives, and with ITM, we get residents that come out and rolling up the sleeves. And we're going to do it again. We're going to keep doing antibody testing as long as we can. We're just very grateful for the city of Miami Lakes for the support that you guys give us. That's at the end of the day, we're here about saving lives. And 1 pint of blood, like I said, saves 3 lives, and that's why we're here. So thank you so much, guys, on behalf of the ITM family. We're here to serve our community.
Thank you.
Thank
Enjoy
you.
it.
All right, thank you so much. And Miami Lakers, give back to your community. This is a great way to do it.
Awesome.
Right.
Thank you. Take a picture, or she can take it with you.
Let me bring it in.
Yeah, right when we're done with the video, we'll take it. Perfect. So thank you very much. That's why it's so important to give back, give blood. If you have you test positive for the antibody, yeah. If you want, we'll take a quick picture now. You right in the middle.
Right here.
There you go.
I got everybody here. Ready? Yes. Thank you.
Thank you.
Thank you very
Thank
much.
you so much.
You see why it's so important to give back, to donate blood. You're saving lives, and if it comes back that you tested positive for the antibody, you have an opportunity also to donate your plasma, which is so important. I know there's a lot of studies ongoing with the plasma to treat the many people that are in the hospital right now. So we all keep coming together. That's a great example. First time donating blood. Look how life works, right? So I'm going to bring up Tony Lopez right now, our deputy town manager, to talk about what's going on, what are the new rules, any changes here in our community, what the numbers look like here in the town of Miami Lakes, and start submitting those questions. Then we're going to transition to Councilman Collazo, who has a special guest with us today that's going to be talking about mental health Thursdays. That discussion needs to be ongoing. We're doing it every single Thursday. So Tony Lopez, welcome.
Thank you, Mayor. Hello, Miami Lakers. I just have a brief update regarding the coronavirus I'd like to share with you today. As you all know, there was an emergency order that was passed earlier this week in relationship to predominantly restaurants, the indoor portions of restaurants being closed. Gyms do remain open, however, there is a requirement to wear masks while utilizing the gym. In terms of numbers of cases, we've had a total of 292 cases to date. In 4 days, that's an increase of about 34 new cases since Monday. This increase is consistent with the increase of cases within Miami-Dade and Florida as a whole. Again, we cannot stress enough that we as a community still are not over this virus yet. Please continue taking all necessary precautions such as wearing a mask, practicing social distancing, and following the rules and guidance provided by federal, state, and local agencies. Only by taking these steps together as a community can we help stop the continued spread of the virus. Also remember, if you don't have to go out, always safer at home. Hola Miami Lakers, solo tengo una breve reporte sobre coronavirus que me gustaría compartir con ustedes hoy. Hemos tenido un total de 292 casos hasta esta fecha. En 4 días eso representa un aumento de 34 casos. Este aumento es consistente con el aumento de casos dentro de Miami-Dade y Florida en su conjunto. Nuevamente no podemos enfatizar lo suficiente que nosotros como comunidad todavía no hemos superado este virus. Continúe tomando las precauciones necesarias, como usar una máscara, practicar el distanciamiento social regla y proporcionadas por las agencias federales, estatales y locales. Solo tomando estos pasos juntos como comunidad podemos ayudar a detener el crecimiento de casos del virus. También recuerda, si no tienes que salir, estás más seguro en la casa. Gracias.
Thank you, Tony. Great job. Miami Lakers, if you have questions, start submitting those now. I know we're getting more and more folks chiming in, but I'm going to turn it over to Councilman Collazo, who has a special guest with him today to have the discussion that's so important on Mental Health Thursdays. Councilman Collazo.
Thank you, Mayor. One of the things that we've been blessed is to live in this community, have this platform to continue to reach out to our residents and provide information. And talking about mental health has been, we've already started to impact lives. And I have with me today Rosie Barroso from the Therapy Labs. And we've worked together, whether it's through the elderly or whether it's been our outreach efforts. We're already starting to see the impact because we're getting the calls, and we want to encourage people to continue to use this platform, continue to use these resources, because we are making an impact. And Rosie today is going to talk a little bit about chronic stress, and I thought it was a very timely topic, because with all of the changes going on and the shifting ground, what's open, what's not, positive cases, we've been exposed to this chronic stress since March, and this has been a prolonged exposure, which is very, very unusual. And whether you've been impacted by coronavirus or COVID-19, or you know somebody, it doesn't matter. It's impacting your mental health and your way of life. And today she's going to talk a little bit about chronic stress, what it looks like, when to look for help, and things we can do on a daily basis to manage that. So without further ado, I'm going to turn it over to Rosie Barroso. Rosie?
Thank you. Hi, everyone. So I'm here to speak a little bit today about chronic stress. Like Louis said, chronic stress is kind of stress that's been going on for longer periods of time, and we're already hitting 4 or 5 months, right? Going into 5 months. Our bodies weren't made for this. Our bodies were made for like peaks of stress and then to come down again. This is the kind of stress that starts to affect us mentally, physically. It might affect our sleeping patterns. It might affect our behaviors. It might affect everything, our mental health, obviously. So it's really important to be aware of that and keep an eye on that, so that you don't fall into the traps. And I think one of the most important things to be aware of you, how you're behaving, how you're responding to people, which piggybacks a lot to what the mayor likes to talk about, empathy. Maybe if you notice yourself being a little more reactive to people, take a look at yourself and assess yourself. Or even for children, because it happens to children as well, their behaviors change, everything changes. Just to be aware of that so that you can seek help if you need it. And setting goals, relaxing, doing things like that are some things that might help you.
That's great, and really, one of the things that I learned about stress and chronic stress, and sometimes our body's ability to adapt or not adapt to it. Think of yourself like a pressure cooker or a pot. There's a finite amount of stuff that you can deal with, right? Until that pressure cooker kind of boils over and then kind of explodes. And that's kind of what Rosie's talking about, trying to pick up on the small cues. Are you snapping? Are you, is your fuse a little bit shorter? Do you feel like over with a lot of anxiety? Those are the triggers or the clues that you should start reaching out, because you need to release that. And one of the ways that you release that is you can create positive ways of dealing with the stress, right? And again, for many, it's been exercise, and I know gyms have been closed, so maybe people have to look out for other ways of exercising. For some people, it's finding other habits, right? So maybe connecting with loved ones, maybe picking up something new, like going outside, and maybe you start taking up bike riding. So finding alternative ways to cope is good. I can tell you when it's not good is if you start finding yourself maybe picking up habits that you shouldn't necessarily be doing. Increased alcohol consumption, substance abuse. Those are triggers, or those are things that you should be tuning into that are unhealthy ways of dealing with stress, and maybe there's an opportunity for you to seek help there. So we wanted to talk about chronic stress, and I think the mayor kind of pointed out as well, it's not just in adults, it's children as well, right? So our kids, the lack of routine, the lack of school, the lack of sports, the lack of the fact that they can enjoy their summer vacation is also going to bring around certain changes. So look for those subtle changes in them, and again, just like we adapt as humans and as adults, give them different opportunities to be engaged, right? So maybe picking up new things. They were into sport before, maybe they can take up painting, other activity that kind of replaces that outlet or that relief valve. Again, giving yourself that release to not necessarily let the kettle boil over.
Right. And also maybe even just talking to them, how they feel, because we're stressed out as well. Taking a moment and saying, hey, are you okay? Or you want to go take a shower, you want to go play with Play-Doh, something to distract them. Because I know I can speak for myself and most other clinicians, my caseload has increased exponentially with younger children. That you would imagine, they're more malleable, they adapt easier, but they're having a really hard time because they regulate themselves off how you behave and how you regulate yourself. And if you're having trouble, they're definitely having trouble.
So Miami, as we're exposed to these chronic stressful situations, as we continue to be exposed, find healthy habits, find healthy ways to find that release valve, and whenever possible, and if you need to, reach out to a mental health professional. We have plenty here in the town, and we have great resources for you to continue to live a healthy lifestyle. So thank you for the opportunity to talk to you about mental health matters today on Mental Health Thursday, and I'm going to turn it back over to the mayor. Oh, great. We got to do this whole thing in Spanish. I'll be a little bit more brief. Hoy estamos aquí con la Rosy Barroso de los Therapy Labs. Estamos hablando de la ansiedad y el stress y el tiempo, el prolongado que hemos estado expuestos a esto. Desde marzo estamos con condiciones diferentes, ¿no?, en la vida, que crea hasta cierto punto una ansiedad. El cuerpo de nosotros, creo que ella lo mencionó, no está diseñado para estar abajo de este tipo de presión por tanto tiempo. Muy importante desarrollar maneras saludables de lidiar con el estrés, o empezamos a tener reacciones negativas. Y por eso estamos hablando hoy de la salud mental los jueves, aquí dándole esta información al pueblo. Te digo, por estos anuncios hemos tenido mucha gente contactándonos y hemos podido cambiar vidas. Entonces sabemos que este segmento está llegando al pueblo, está llegando al público y está teniendo un impacto. Entonces hoy tengo el lujo y el beneficio de tener aquí Rosy Barroso de los Therapy Labs, que quería hablar sobre la ansiedad y el estrés crónico. Rosy.
Él casi dijo todo lo que iba a decir del estrés crónico, pero es importante de tratar de observarse uno mismo y ver cuando ya está llegando a niveles que no puede aguantar, y buscar diferentes maneras de aliviar el estrés, como maybe haciendo ejercicio, hablando con una amistad, conectando con alguien, haciendo un puzzle, algo que sea positivo. Y también hablamos sobre hábitos que no son tan saludables, tomando más, quizás usando drogas ilegales o drogas legales, pero tratando de tapar las emociones con otras cosas. Si usted ve que está llegando a esos puntos, llame a un profesional que tiene tiempo que pueden ayudarlo. Y también observar los niños, porque los niños también, ya en todos los niveles y todo el tiempo que nosotros estamos abajo de estrés, los adultos, ellos se regulan basados en regulaciones de nosotros, emocionales de nosotros. So, usted va a ver que quizás las emociones de ellos no estén tan niveladas. So, pregúntele cómo están, dale un momentico, hey, ve y toma un vasito de agua, ve, respira un momentico, vamos a hacer algo divertido en vez de reaccionarle, para que ellos también vayan bajando sus niveles de estrés.
Y también una buena sugerencia, crear una rutina normal nueva. En estos cambios, yo sé que todo se ha desnormalizado, ¿no? Pero muy importante crear una rutina, porque eso también hasta cierto punto provee ese alivio, no tanto igual para los niños, tanto como los adultos. Entonces, creando estas nuevas rutinas, entonces si tenías algo que que tú estabas haciendo antes y ahora no lo puedes hacer por las regulaciones o porque posiblemente no está el lugar donde tú ibas abierto, trata de buscar otras maneras saludables para reemplazar eso o crear nuevos hábitos, ¿no? y tomar esa oportunidad para crear esa rutina, cual también te va a beneficiar emocionalmente y la salud mental.
Y llamar a alguien, porque como nosotros todavía tengo el lujo que puedo proveer terapia gratis, o a nosotros nos puede llamar. Yo sé que hay otros terapistas de Miami Lakes también que nos están ofreciendo. What I said was that we're still offering free therapy. I have the luxury that I'm able to. So if anyone needs anything, you can reach out to us. I know there's other clinicians in the town as well that are really good, but not to hesitate to contact someone when you reach that point. So no, how do you say hesitate?
No aguantar, no esperar, no demorar.
No demorar ni llamar a alguien si ve que no puede controlar las emociones, si ve que ya están llegando a un nivel que no está saludable y no puede bajar el estrés que tiene. Llamar a alguien para que lo ayude.
Thank you, Rosie. And Miami Lakers, whether you're insured, uninsured, we have the resources to help. Feel free to reach out. Thank you so much. I'm going to turn it over back to the mayor and Tony.
Thank you, Rosie. Great job. Thank you, Councilman Collazo, for really being the one that started all of this, started this discussion in our community going forward, which we know is so important. There's a silver lining, right, in this whole pandemic. One of the things that we've seen is that telehealth services in the U.S. rose from 8% in December to like I think 29% utilization in May and June. So you're starting to see that access to healthcare become more easier. Where before we were having issues throughout our country where healthcare, some folks said the healthcare access was very difficult. So imagine you can get an appointment with some of the top doctors in the nation, not only on the mental health side, but dermatologists, you name it. Any type of doctor, and have these types of discussions, be it on the mental health side, or if you have any issues. But telehealth is so important. I'm so happy to see that expand because it really starts bridging the gap when it came to accessibility of these services. And I know here locally there's a lot of doctors that are willing to help. There's a lot of professionals like Rosie that are willing to step up via telehealth, and which is a silver lining. So we're going to start taking some of your questions. Do we have questions on Twitter? Because we go live Twitter, Periscope. We are live also on YouTube, and we're live on Facebook.
Okay, yes, Mayor, we have a question. If you're walking around your neighborhood or walking your dog, do you need to wear a mask?
If you're walking your dog or you're walking around your neighborhood, do you need to wear your mask per the Miami-Dade County order, Tony?
Yes, the only time you're exempted from wearing a mask in a public space or public walkways if you're doing any strenuous exercise, you're a child under 2 years old, or you have some sort of respiratory issue that prevents you from doing so. So the answer is yes.
So if you're riding your bike, if you're running, you're jogging, you don't have to walking around, just walking your dog, going to the mailbox. Unfortunately, due to the county's order, you do have to wear your mask.
Okay. And we have one more question. What what is the threshold that we have to reach in order for businesses and restaurants to open back up again? As well as, has the town considered the number of deaths that are that are happening?
Tony?
Really, the threshold, we are taking our guidance from Miami-Dade County and the experts that they're relying on to give us their information. There is no set threshold at this time. What we do hope is once we see a trend downward, and we hope that if we all can get together and make that happen together as a community, the quicker we can get our restaurants reopened. And also, in terms of the death rate, that's something that we also are taking information from the state, and we are also monitoring carefully. And that's really what we are doing on a day-to-day basis, both from positive cases down to the deaths that are happening in Miami-Dade County.
Yeah, just remember that even the epidemiologists, even the infectious disease doctor, changes on a daily basis. This is a novel virus. Nobody's had time to study it over a year, over 2 years, over, like the common flu and other illnesses, other viruses. I mean, there's so much data behind that, but what's happening right now, everybody's collecting data. So we've seen, and I know I talked about this yesterday, where folks were talking about, hey, infectious surfaces, they can get you infected, or an asymptomatic individual, there are super carriers, and we saw that information change. World Health Organization, CDC, things are going to keep changing when it comes to this virus. There's still a lot of folks studying it. The good thing is, it seems that hospitals are treating this virus and learning from it, and from all these several months. So they're treating folks, and we're seeing a lot of folks leaving the hospitals, which is a good sign. Getting healthy and getting out, which is a very, very good sign. I don't know if you wanted to chime in.
No, and again, what's most important is just continue to follow the same guidance that we've been saying from the beginning, and use common sense. Wear your mask. It's there not just to protect you, but it's also to protect the people around you. Sometimes what we have been seeing with the spike is it's been happening when people have maybe let their guard down. So make sure that you continue to wear your mask. It's one of the safest things you can do to protect yourself and protect the people around you. And basic hand washing and hygiene. We probably, at this point, everybody knows somebody that's either had the virus or come down with a virus, or maybe somebody that they even work with. The point is, if you're following these precautions and you're not relaxing these precautions, the likelihood of you getting sick is almost zero. So again, just go back to those best practices that we were doing way back in the beginning. Make sure you're using proper hygiene, make sure you're wearing the mask, and make sure that you're conscious about where you put your
Absolutely. Ashley, anything? Twitter, YouTube, Facebook?
No, Mr. Mayor.
So we'll give you about another minute to submit some questions. If you don't have any, we're going to start closing. Councilman Coelho, anything else you wanted to chime in on Mental Health Thursday? Anything else for folks at home?
No, it's just two announcements that I do want to make, that I've had the opportunity to make every time that we're here on Mental Health Thursday. On July 6th, the Hope United Methodist Church is going to be having another food distribution. That's going to be on a Thursday, so want to make sure the community is aware about that. There's still a lot of people that are going through nutritional insecurity, and Hope United Methodist Church has made it a mission to make sure that the individuals here in Miami Lakes have that opportunity, so wanted to make that announcement. And just a real personal announcement that I want to make sure that I make before this is over. I do want to wish my wife, Clarissa, a very happy birthday. She's still very, very young, and she'd probably kill me if I disclose how old she's turning, so I'm just going to leave it at that. But I just wanted to wish you a happy birthday from Lucas, Cody, and myself. Happy birthday.
Happy birthday, Clarissa. Tony, anything else you wanted to chime in?
Just a reminder, everyone, as we're going into the weekend, stay safe, practice all those guidelines. And again, this is a collaborative community effort. We take the steps, we get the trend down, and we can start progressing back to open restaurants, reopening our gyms in a more less stringent capacity, getting back to what we consider to be a new normal. So just remember, that's a collaborative effort. We all need to take our individual steps to make happen
Definitely. Anything else? Anyone else chimed in between?
No,
We're
no.
double checking, seeing no questions. Miami Lakers, be safe. We are in this together. We will get through this. We will win. Reach out to us 305-364-6100. That's 305-364-6100. The entire council, our staff, our volunteers, we're here for you. Reach out to us